Welcome back to Taking Charge of My Cancer podcast, episode 61. Join me today is Dr. Robin Galley. She is the Director of Clinical Education and Associate Professor for the NSU, which is Nova University in Tampa DPT Program. In this role, she is responsible for securing placements for the students to complete their full-time clinical experience across Florida and the country. Dr. Galley facilitates the entire placement process, including the follow-up and in-person site visits once placed. She serves as a direct line of communication to the program during the clinical experiences and offers assistance and guidance where needed to ensure successful clinical experiences. She also serves as a lab assistant and guest lecturer with multiple courses, including the musculoskeletal series, clinical skills, integumentary, and exercise physiology. She's a board-certified orthopedic specialist and oncology rehabilitation expert. She's also a certified lymphedema and woundcare therapist and shares her expertise with the students in the program. She serves as one of the clinical mentors in the Orthopaedic Resident Program and is a faculty serves and one of the clinical and supervisor for students and the pro bono clinic through Sharp Motion. Prior to entering academy in 2012, she worked full-time in private practice, outpatient orthopedic settings, and complete part-time work in multiple settings, including acute care and oncology rehab, which she continued to work at Moffitt Cancer Center today. Dr. Galley enjoys her time with the student and is happy to be able to continue her work as a clinician in the field of oncology, where she feels she can truly have an impact with the patient population she holds dear to her heart. So she is a breast cancer thriver and diagnosed with the stage 2B breast cancer in 2016 at age 38. She has firsthand experience as to what it's like one to other side of the treatment table during her battle with breast cancer. She endured 6 rounds of chemotherapy, 18 rounds of immunotherapy, a double mastectomy, more radiation reconstruction and revision. She learned firsthand what it means to be your own advocate and the importance of physical activity through cancer treatments. Today, she's cancer-free and appreciative of her journey. She's motivated to encourage others to hear the words, "You have cancer, so they do too can thrive." So thank you so much, Robin, for being here with me today. I really appreciate it.
Yeah, absolutely.
So we go back when some of the clinical lead, I don't know, it's like what, a student clinical leader, coordinator, however you call it, all these initials I cannot catch anymore.
Yes.
For
Yes.
for one of the clinics here in our UF Health here in Gainesville. So I'm the one in charge of the students that comes for their internships here. So we know each other, man, how many years? Maybe over 10 years?
Yeah, I think so, because I started with Nova in 2012. So yeah.
Back then.
Yeah.
So we know each other, and I think we just clicked just because I think I met you. I don't know if I met you when I was doing ortho, when I already started doing oncology. I don't remember that. But I know when you came for a site visit and we started talking about oncology, we just kind of like super excited just because again, you're a
Yeah.
breast cancer survivor and and doing amazingly well. But then using that as a tool to teach students how important is oncology, and so glad to see how in our profession this field is growing and growing and growing, and I think has more power, since what, 3 years ago, since now we have a specialty in oncology,
Yeah.
APTA. So, yes, so glad that you're here with me.
Yeah.
And would you want to tell us a little bit about how did you land in academics?
So, well, and just to go back, I believe it was 2016 was when we first met in person, because that was when I made my site visit there, and I was actually in the middle of my chemotherapy treatments at that time.
Oh,
And
wow.
so, yeah, because I continued to work through all of that. But yes, I remember telling that to you, and I remember you were taken aback a little bit because I said, actually, on a personal note, I'm currently going through treatment for breast cancer, and I think
Remember that
we
now.
Yes, and then we immediately connected after that. And but yes, so that was when we first met in person. I was just starting my treatments with breast cancer, and I had started with chemo. So, but anyway,
And then I want to go back to that a little bit, like how do you manage to have such a big responsibility with that and then managing treatments? We should talk a little bit more
sure,
about that.
sure,
But if we go back to my first questions, how
yes.
do you end up being where you are now?
So, if you had asked me when I started my career, are you gonna, be a teacher one day? Are you gonna be, a professor? I would have said, heck no, that is not what I'm interested in. But what I learned through the course of my career, I've been practicing since 2001, so 23 years, I guess. Gosh, which is weird because I'm in my 20s. So, um,
Exactly. You were born like that, right? You didn't
yes,
have to go to
exactly.
school.
So,
Emoji
what,
here.
yes. And what I really learned, I learned so much about the career of physical therapy after school was over. There's so much more I learned about it. And honestly, the career has morphed. It's even changed to a doctorate profession since I first started. And, when, when I first started out, what I realized is that, when I work with patients, we are teachers to our patients. We are teaching from the beginning of our career. So for anyone to say, well, I don't know how to teach, if they're a physical therapist, they absolutely do know how to teach, because it's what they're doing with every patient they see every part of the day. It's a huge part of what we do to be successful as PTs. So it occurred to me over time the amount of teaching I was doing. And then I would take students into the clinic. So I would be a clinical instructor. And I realized how satisfying that was. The satisfaction I get from treating a patient and watching a patient recover and reach their goals and get from point A to point B is why we're all physical therapists. But I was thrilled with how exciting it was to see when one of my students in the clinic suddenly, had that light bulb go off, or they were suddenly, doing a full evaluation and I didn't have to step in once. And to see, it was very satisfying, because not only am I seeing a patient get great care, but I'm seeing a student learn how to be a clinician. And so I started getting a lot of satisfaction from that within my career. And as time went by, I became a mother. So I have now a 16-year-old son and a 12-year-old daughter. And when my kids were young, working in private practice, I was probably putting in about 60 hours a week. And it was tough. It was tough when a kid got sick at daycare. It was tough for me to, how I couldn't be there from them. So I was really struggling at that time in my career, what I wanted to do. And I decided to go back and get my doctorate. So I got my transitional doctorate degree just to open up more doors, because I thought, if I want to teach or maybe adjunct in a program, I knew I needed a doctorate because it's now a doctorate profession. So I went and did that. I had a full-time job. I was from about 4 a.m. to 6 a.m. every day. I was at the computer working on my doctorate. And then I would, continue my life as a mom and a clinician. And it was
Wow.
super busy and crazy. And then as soon as I got my doctorate, as soon as that finished, lo and behold, as if it was meant to be, there was a new program in town called Nova Southeastern Hybrid DPT Program. They were the first fully hybrid program in the country. And I thought I would just throw my hat in the ring to be the director of clinical education that they were putting out there. I'd never taught a day in my life. I thought, for sure I'm not getting this, but I wanted the practice of interviewing to learn more about it. Well, I don't know. I don't know what happened, but
Meant to
for
be.
some reason they hired me, and I've been there ever since. And it truly has been, it allowed me to continue, in that role. You're allowed to continue to work once a week in the clinic. And so I've never stopped working in the clinic. So I would never lose that connection to patients. But now my satisfaction comes from watching, students become clinicians and doctors, which is really cool.
Yeah, that's amazing. That's a great story. But when meant to be, like I think I told you my story how I landed doing oncology from doing orthopedics. Same thing.
Mm-hmm.
Like, yeah, I kind of want to look for something to lead. Let me just lead a program, and that was an opportunity in this clinic. And they're like, would you like to do something with oncology? And I'm like, I don't really know much about oncology. I'm just
Mm-hmm.
an orthopedic therapist, and very sensitive and very high energy. And I'm like, I don't know how I'm gonna handle these patients, right? Thinking like it's gonna be sad, it's gonna be really low key. And when I came and shadowed some of my colleagues, I totally fall in love with the patients, and I don't regret every minute of it. And I've been doing it for like what, the last 15 years of my career. So I love
Yeah.
every minute of it. So
It's such a misconception of working with oncology. People often say, isn't it sad?
yeah.
And, you know, sure, there are times in that you lose patients and and people lose their battle with whatever cancer they have. But what it did for me was it put a lot of things in life in perspective. And I learned that these patients are really grateful. They're grateful for being there. They're grateful for you. They're great, you know, it was just a whole new level. And what I found is they tend to be more positive than some of the patients I'd had in the past in the orthopedic setting.
Yep.
And I was really, and it was a really cool thing to see. So I've tried to work to teach our students that, you know, oncology is not a sad setting. People don't walk in there with their heads down and, you know, this is so sad. And if anything, you learn a lot from these patients, and you learn to appreciate life at the end of the day. And that's a pretty cool thing to do.
Yeah. And actually, in the middle of all these treatments that they get in, they're looking forward to come see us. We are like the light in the middle of their treatments, right? We are the
Yep.
ones who either push them,
Mm-hmm.
and they're like, oh, I don't know if I want to do this bike today. You're gonna kill me. And then they feel like a different person when they walk out of here. And they actually really, most of them look forward to come and see us and like kind of make it really better in the middle of all these treatments that they've gone through.
Oh,
So
yeah.
you were already doing this role when you were diagnosed with your cancer. How
Mm-hmm.
how did you manage that? Tell us a little bit about, like, you know, what happened there. Tell us a little bit about your diagnosis. Like, what
Yeah.
were you at on your life when that happened?
Sure. So I was 38. My kids were 4 and 8. I was working as the DCE. I'd been there for about 4 years. Excuse me. I had been working at Moffitt also, treating, ironically, breast cancer patients quite a bit. Primarily in the outpatient, but I'd worked in inpatient as well. So I'd been there for a while, and my diagnosis came. I also was a very competitive CrossFit athlete, and I was training for some major competitions, some international competitions, and so I was in pretty good shape, I felt. And I was taking a shower one morning after a workout, and I just reached across to clean under my arm, and my finger grazed across a lump. And I had a very small chest, so it was very easy to feel. And I knew enough to know that, that lump wasn't there yesterday, because I washed there yesterday and didn't feel that. And it was firm, and it was odd shaped, and it was painless. And being in the profession I was in, I knew enough to know, oh, I should probably get that checked out. However, I also was not worried at all. I'm healthy. I've never smoked a day in my life. I nursed both my kids. I did all the things, right? I did everything I was supposed to do. And I thought, you know, it's not me. And I was on a paleo diet, you know, nothing processed, just all the things you're supposed to do. I did them. So I went in, and this was where, and I know this is probably going to come up, but this is kind of leads me to one of my first learning lessons on advocating for yourself. And I showed up. It was on Christmas Eve that I found the lump. So everything was closed. Christmas Day came the next day. And so then as soon as everything was open again, I think it was like Monday, 3 days later, I walked into my primary care physician's office. They had a full waiting room because everyone's at the end of their deductibles trying to get in their appointments. I had no appointment. I showed up at 8 o'clock. There was only one physician working in a group that normally has multiple physicians. And I walked to the counter and told them, I need to see somebody. I think, you know, I just need to get a referral for an ultrasound and some testing. And she said, I'm sorry, we don't have any openings today. I can get you in 3 weeks. And I said, no, I just need to see, it'll be quick. I just need a referral for a mammogram and an ultrasound. And she goes, I'm sorry, but we're full. We only have one person working. So then again, I said, I'm not going to leave. I need to see someone. And she goes, well, what is it that's going on? So I, in a relatively loud voice
I love.
with the whole waiting room right there looking, I said, I found a lump in my breast and I'm worried I have breast cancer. I would like to see the physician so that I can get a quick referral to get a mammogram and an ultrasound. And her eyes went really wide and she's like, okay, ma'am, have a seat. And she steps away from the counter and then the door opens and the physician goes, Robin, come on back. And I beeline to the back. And do I feel bad about it? No, I don't. Because had I, given what ended up happening, so she saw it, I had all these stat tests done, and then they found not only that tumor, but there was a second tumor. So then they, sent me for all this testing that I had done the next week. They found there was a positive lymph node as well in the testing after the biopsies. And the type of cancer was a very fast growing cancer. Had I waited 3 weeks on that, I might not be here today. So I will always say, sometimes people, we're so kind by nature, right? And we don't want to upset somebody. We're like, oh, okay, we understand. And we always say, okay, and we kind of back down. But it is okay to say, no, I need somebody now. If you know something's wrong and you need to step in and advocate for yourself, do it. So I did. And then that's how I found out. And after I had went through all my testing, I got a phone call while I was at work. And I had told one person, I had told my boss, Mary Blackington, I had told her what was going on. And so she's like, okay, I'm praying for you. And so I got the call while I was sitting at my desk and they said, and I also told them when I went in, they said, can we call you no matter what the diagnosis is? And can we tell you it over the phone? And I said, yes. I didn't want to have to make another appointment to come in to hear whatever news it was. I said, yes, you can tell me anything over the phone. So she did. She said, you have cancer. There's 2 tumors. There is, a positive, it's in the lymph nodes. And they started going through everything. And I hear chemo, and that it's starting with chemo. There would be mastectomy, most likely. There would be radiation. They're going over all these things.
Oh my God.
And then saying I have to get all these testing because knowing that it's in the lymph nodes, it could be anywhere else in my body now. So I sat there, I went into clinician mode and I said, okay, and then when does this start and how do I do what's next? And I was just, it was almost like I was treating a patient, not myself, and I was very calm, very collective. I hung up the phone and then it hit me. And it was like, oh my God, this isn't a patient, this is me. And I lost it. And my boss comes in the office and she's the first person that knew. She hugged me. We both cried in my office. She's like, whatever you need, we're going to back you up. And so immediately I knew I had support, which was an amazing thing. And I know I was very fortunate because not everybody has that in their profession. And so, so that was how I discovered that I had it. And I had a very supportive work environment, thankfully, a hybrid work environment that allowed me to work from home as needed. And that's how it all started.
Wow. Amazing, right? I mean, you just know, you just don't know when it's going to happen to you, if meant to happen to you. And no matter, how good take care of your body you do, but when happens for whatever reason. So, what do you think was your way, like when you were going, so you have neoadjuvant chemo first, correct? Which is audience chemotherapy before surgery. Do you think, how was that experience? What do you think you did that kind of helped you to have, the best quality of life possible going through chemotherapy?
Well, I went into chemotherapy very strong. It was the very first part of my treatment. So, right after I found out I had breast cancer, just before that, I had qualified to go to this big competition down in Miami for CrossFit. And then I found out I had cancer. And my initial instinct was, oh, now I got to cancel this. But then I stepped back and I went, wait a second. This is something I worked really hard for. I'm still the same person I was 10 minutes ago before I knew I had cancer, right? And these treatments aren't starting until 2 weeks from now. So I thought, I'm going. So I went down to Miami. I competed in this 3-day competition, knowing that I had breast cancer, knowing that I had no idea what the rest of my life was going to look like. And this might be my only chance to do it. And I took it as an opportunity to remind myself of how strong I am physically, that I can get through this, right? And so I also connected with, at the time, there was an organization called Barbells for Boobs. They're no longer around, but it was an organization of athletes female athletes that had breast cancer. So most of them were very young, very active. And it was a great group for me to get connected with because they were my people. They understood, like, I don't want to just survive this. I want to like thrive and still be amazing after this. Like I'm not willing to just say, okay, well, I just want to live. No, I want so much more than that.
Mhm.
And I want to feel okay about that. Sometimes we feel guilty for wanting more, like, well, at least you're alive, but there's so much more. That's why I call myself a thriver and not a survivor. I'm a thriver because I'm still going and I'm doing everything. And so what I did was afterwards, through like when I started with chemo, I kept doing CrossFit. I kept working out. And there were some days that I went in and I simply did lunge walks around the gym, or I walked slowly on the treadmill as everybody else did stuff. But I continued to engage socially. I continued to get sunlight and walk outside when I could. When the waves of depression and darkness would set in after each round of chemo, I made a point to keep my blinds open so I could get sunlight. I made a point to step outside. I made a point, a very, thoughtful, like cognizant point of don't succumb to that. What you'll hear a lot is rest, 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 get your rest. And I did, and that is important. But what happens is I think sometimes people just rest, they just lay down. And it's easy to just do that because you've got a really valid excuse. You've got this, yeah, but nobody's going to question you if you say, I just want to lay down, right?
Yeah.
I mean, of course you do. I'm a mom to a 4-year-old and an 8-year-old, and they've got busy lives, and I'm working this job, and I have cancer. So yeah, nobody would question me if I said, I just want to lay down and I just want to rest. But what I realized is that I did start valuing sleep more. I did start trying to make sure I got to bed. I learned to go to bed even if my kids weren't in bed. I was like, forget it. Like, I'm going to sleep. I'm going to go to bed now. But I got up and I continued to live my life so that I didn't want cancer to be what took over. I didn't want it. And I loved it when I would go for my appointments and somebody would say, you don't look like a cancer patient. And I was like, thanks,
Yeah. Like how we're supposed to be looking.
I mean, I'm glad. What does that mean? I don't look like I'm about to die. I don't look sick.
Yeah.
What does that mean? Like, I guess thanks, but it's unfortunate that that's just sort of what the mindset is then you just have to. And granted, I look back at pictures now and I realize, oh my God, my cheeks were sunken in and my eyes were dark. And so I do see what that is, but I never felt that, or I wanted to make sure for my kids that they didn't see mom folding over, as best I could. I had bad days. Don't get me wrong. I'm not Superwoman, but I think going through chemo, I just made a really cognizant point of staying as active as I could. And when I was because it changes, it's on waves. So during certain times in between chemo sessions, I felt normal and I would do my normal things. And then during those downtimes, I tried to just do as much as I could, but not just giving into it.
Mm-hmm. And that's a great, not just information, but this is kind of what what we preach from the PTA standpoint to the patients, right? So how do we combat cancer-related fatigue, right? What the research shows, exercise, right? 150 minutes of exercise a week, 2-3 times the strength training, and not 2 pounds of strength training. We're looking at 70% of max, weight or like RPM. So it is just really nice to see. And I'm sure when this happened, how long ago was this? That was 2016.
2016.
Exactly. So now it's so nice. When I started doing this, that was, about that time when I started working in oncology. And at that point, we were not doing what we're doing now, which with a lot of our neoadjuvant chemo patients, I work them out right before they go upstairs for infusions, and we working hard. Not working just a little 2-pound weights and a little like riding the bike gently. We really getting heart rates up there and working up there. And then it's all these research doing on tumor environment, how you can enhance chemotherapy and radiation if you exercise prior to it. But it's not a lot of proven in humans yet. But what I know when I start doing that is like a lot of that secondary effects decrease so much. And I have had many patients like you who I want them to continue being active. I want them to run marathons. I want you to keep them. I want them to continue doing whatever they love to do and not give that up, right? Just don't let cancer determine your life.
Right.
You are the one who is controlling that, right? It's certain things you have no control. You have no control over
Sure.
how you're gonna respond to it, or what's next, or you know what type of surgery you're gonna need. But you can control how you feel and how you can feel better to try to really fight that. So
Absolutely.
that's so great to see that. So
I had during that time, I had this little motto that I would say, you know, how people say winning isn't everything. My motto is winning is everything. Winning is everything. Like, and by winning, I mean, you know, getting through this, it is everything.
yeah,
And so I kept focusing on that. No, winning is everything. There is no giving up. It's winning is everything. And you keep looking forward, and, you know, you let yourself have those moments, you let yourself have those bad days, but then you get up, you put your big girl pants on and you keep going.
so tell me a little bit. So you're still working. You're
Mhm.
still working with the students. Did your students know what was going on with you? Did you use your experience to help them, you know, to like
Mhm.
learning through your experience how to deal with patients with cancer? Or how do you manage that?
Sure. So during the time when I went through it, they definitely knew, because there were going to be times that I wasn't there. And, you know, I never did lose my hair, by the way, because I froze my scalp. So I managed to have hair. Now my hair got very thin. So a lot of people would probably have noticed that that something's going on with Dr. Galley. Oh, I'm sorry. My dog is on the other side of the door, of
That's
course. Um, but what I did, we announced it to the class. That was another thing that I would say is one of the things for me, that was very helpful. Some people handle it in a very private way. I decided I made another conscious decision that I was going to just put it out there. I was just going to tell everybody. I sent a text message ahead of time to some of my closest friends. It was a group message. I'm like, I'm sorry for the group text, but I need to tell you guys what's happening, because you're about to see it on Facebook. And I want you to hear it from me. So I, you know, kind of gave them all. And these guys were great. And I had different people signing up to come sit with me. But I put it out there on Facebook, and I told everybody what I was doing. And then I shared my journey along the way. I shared updates, I shared things. And honestly, what was so good about that is that's how I connected with the right people. That's how I connected with people that I am still connected with today, and that helped me through it at that time. And I would have complete strangers reaching out to me, you know, thanking me for whatever it is I said, or asking me for advice, or helping me in my journey. And it was really helpful. So with the students, I was very open with them. I told them, you know, if they had questions. So I've had some students come to me and tell me my mom was just diagnosed. What can I, you know, I don't know how to help her as a, you know, daughter. And, you know, that's a question a lot of people know is what do I say to them? How do I help them? What do I do for them, for my loved ones? And so I've had a lot of people come to me that way. I've left it open. And I also, in one of our classes, I'm so sorry.
That's okay. No worries, no worries.
In one of our classes, we have they do an interview with me. I think it's in the cultural competence class and understanding patients and things like that. And they do an interview with me where I tell them about my cancer journey and what it was like as being a patient, so they can understand from the patient perspective. One of the things, and again, I'm sorry for jumping around here, but this might be something coming up, but one of the things that I also learned, I think I became a better clinician after going through this. Certainly with the oncology population, I did. And because until you've been on that side of the treatment table, you can never really understand or appreciate what that's like. And for me, being on that side of the table, there was, for example, I did not have surgery where I was originally going to have surgery because I wasn't happy with the plan. And that was another time where I advocated for myself. I reached out to some people I'd met through Barbells for Boobs, and I said, you know, what do you guys know? And someone connected me with this wonderful doctor at Emory and up in Atlanta. And I went up there, and luckily they did not take all my lymph nodes like they wanted to take at the other location. They listened to me, and I had a really great experience there. But one of the things that I learned from that is the surgeon that I decided not to use down here. Later on, I developed a seroma after my surgery and coming down, and I'm in the room. I'm not feeling well. I've just started radiation. I had this seroma, And they said, let me go get the surgeon and see if they can take a look at it. And I hear her in the hallway say, oh, no, tell her she can go to Atlanta. That's not my patient.
Oh my
And
God.
I cried. I cried. I was so, and then I also, it hit me hard because I hate to admit it, but those words have come out of my mouth before. That's not my patient. And it made me realize that as clinicians, we need to never say that. We need to never say that's not my patient. It's easy to do, and I don't fault anyone for doing that. You know, we got to get home. We all have our lives too, but realize that these people need you. And just because they're not on your schedule or they're not your patient, if you can help them, if somebody comes to you or asks, I think we should need to like refocus how we look at, you know, the patients that walk in our doors, whether they're on your schedule or someone else's. You know, so I've kind of re-looked at, I vowed I would never say that again in my life. I've instructed students, don't ever say those words. Realize what you're saying. Think about that if that was your mom or if that was your, you know, your daughter or your, you know, spouse. Like think about what that means and how that makes a patient feel, because they might hear that and they're going to certainly see that and recognize that. So that is something that I've tried to share with the students along the way, is that patient perspective to help them be more empathetic as practitioners and compassionate.
That's, it's funny because, I have said that before. It's like,
Mhm.
oh God, I have, like, if somebody come and ask a question about something, it's like, I really don't know how to answer that because I have never seen them before. And that means, I need to stop what I'm doing with the patient. I'm doing to go check their chart and to try to see if I can figure it out. We try not to ignore it. We try to let me just reach out to your therapist and hopefully we can get you help, right? Versus just totally dismiss them. But yeah, that's terrible that you did that. And I'm so glad that you were able to go, look for help. And that's something I always encourage patients. It's like, don't buy everything your doctors tell you, right? You always need to get second opinion. If you're part of it, you're not just another piece that people tell you what to do and you're just gonna say, okay, I'll do that. And I understand that many patients out there are just really to the mercy of like, but if they tell me to do that, it's because they know better than I do. So if you told me to do that, I'm gonna do it. I'm not gonna questioning. But it is a great idea. And if you come across a physician who does not want you to get a second opinion or they feel that they know it all, you're with the wrong physician. So physicians who are great at what they do, they always going to encourage you, welcome to go get second opinions. We get second opinions all the time here.
Absolutely.
It's totally okay. Go find it, whatever works better for you. Sometimes can be just chemistry, right? You have no chemistry with the surgeon or no
Yeah.
chemistry with the medical oncologist. Go find somebody else that you're going to trust, because if you
Yeah.
don't trust, then things are not going to go well.
And as patients, you know, we need to understand that, you know, yes, we need to listen to the doctor. We need to, you know, take in what they say. We need to process it. But it's okay to do our own research. It's okay to ask others the second opinions and recognize that at the end of the day, the person who calls the shots is the patient. They get to decide. The doctor's there, the PTs, the OTs, the speech, whoever they work with, they're going to make their recommendations based on what they feel is best for that patient. But at the end of the day, it's a patient's choice. It's the patient's decision. And sometimes we forget that as practitioners too, I think.
Yeah. So you already kind of give me a couple of valuable tips that you learned through your journeys. Any other good tip there that you have under your sleeve? I'm sure it's plenty.
You know, well, like I said, I think for me, I'm really glad I was open about it and I shared my story with people because it made other people feel like they could share their story, or it made other people feel comfortable sharing what was going on. I also, you know, activity, being active, those are, you know, things that I've learned, and of course, advocating yourself. So all of those things that we talked about, you know, and asking questions, you know, go into the sessions and be that annoying patient if you need to, and ask the questions that make you be able to walk out there and go, yes, I like this plan. Or nope, I don't think this is the plan for me. I want to talk to someone else. Because that's the only way. It's okay to question people. I've heard people say, well, I don't want to upset the doctor, or I don't want to upset them. And it's funny because it's like, well, it's your body. I've had people say, yeah, well, you know, I didn't want them to remove all my lymph nodes, but they did because that's the protocol. I hear that a lot too. Well, that's the protocol. but we are all individuals. And just because there's a protocol doesn't mean it's an automatic fit for everybody. And so now, and I think in fairness, you know, I'm a clinician, so I have a little higher understanding of some of these things, and I know what questions to ask. There's a lot of people that don't.
Yeah.
And for those people, you know, I would just say, you know, advocate for yourself. You know, find other people that have been through this. I love that, you know, I know they're at UF, and where I am, we do a lot of doctors do like prehab for the patients, and they have an opportunity to ask questions before they've gone through anything. And you know, those things are really important for people to do, and not to feel bad to ask. And no question is a dumb question when you're talking about a disease in your body that is doing something, you know.
Exactly. And I tend to do that. Like sometimes patient ask me, what is your opinion or ABC? And I was like, you know what? This is my opinion, but I want you to write all those things and search for those things. Like, go look, don't do Dr. Google, but do the right places where you can do. You can go to the American Cancer Society. You can do, it's so many really good information who is actually medical based, not Google based. And then it is great to look in groups as well, but just careful with the groups, right? You can have in these groups patients that are totally, it's your story. So if you have great outcomes like you, it's going to be a good story. If you have bad outcomes, it's going to be a bad story. And so many things out there can really scare you, and that not necessarily is going to be you. You are you, and the outcomes can be totally different because you're a different body, right?
Right.
So
And
all,
honestly, yeah, that's the other thing I was gonna say is that you're also gonna get some people that give you their unsolicited advice.
yeah,
And that in and of itself can become overwhelming. People
yeah,
like, oh no, don't do this. Oh no, use this med, don't do this med. This means what that, you know, and a lot of people, and they're just trying to help. But you have to remember that what works for one person, just like with anything in medicine and in you know, therapy, just because a technique works on one person doesn't mean it's going to work on another person. It's the same thing with these treatments. And you know, my experience with chemo was really positive. It didn't affect me that much, but radiation really took me down. And I hear a lot of other people say the complete opposite, right? So
yeah,
it really is specific. And so you can't, you know, with a grain of salt, when you hear other thrivers talk about their journeys, realize that that doesn't mean that's going to be your journey. But
yeah.
it's just food for thought and understanding. And I also try to be positive with people as much as I can. And you know, when you do look for like groups, like support groups and things like that, it's sort of like online dating, right? Like from what I hear, I haven't done it, but like you got to weed through some not so good ones, right? To find the right ones, because you know, the first few I went to depressed me, and I was like, and you know, and most of them were older than me. And they were talking about, you know, recurrence and dying, and it was not in any way helpful to me. And I knew that was not my group. But don't be discouraged if that happens, because there are so many groups out there now. And there's, you know, look for things like, if you're younger and more active, look for young cancer survivors, or young, you know, look for things like that that can fit kind of your demographics and people that might be able to relate to you better. I had so many people telling me initially, like, oh, you shouldn't be lifting weights, that's too much, and you shouldn't be doing this. And the truth is, sure, maybe if I'd never done that before, but that was who I was going into it. So it was important to continue being that person through it to the best of my ability. You know, it didn't mean to
Mhm.
stop everything right at that time.
Yep, yep, absolutely. How about your most painful lesson?
You know, I guess probably the most painful lesson was hearing those words, she's not my patient. That was probably the hardest thing I went through, and realizing, and then also self-reflecting and realizing I've said that before, and realizing that how, you know, I needed to take a step back and approach my patient care a little differently, and look at it more from the holistic, and not, this person's on my schedule from this time to this time. Now I'm going to be on this person, and, you know, very tunnel vision, and maybe take a step back and be more of a team player, be more, you know, how can I help? Maybe I hear somebody helping somebody and I have something to offer that maybe they wouldn't know. And maybe I say, hey, you know, pull that clinician aside. Hey, have you tried this technique with so-and-so? You know, if you want, I can show you. Little things like that. It makes you a better clinician, and you'll have better outcomes.
Okay, great. How about a painful lesson on your journey with students?
Hmm. uh, with my journey with students. Well, related to cancer or just related to students or?
Related to students, like just on your role now, you know how, I mean,
Yeah.
I can think of, let me think, I can think of as a couple of students I have to fail coming
Uh-huh.
here for internships, and that wasn't fun.
Sure.
That was hard
Yeah.
to do, but I wasn't gonna allow
Hmm.
my colleagues to be out there when they're not prepared, right?
Right.
So
Right.
so I'm sure that on those lines, like how do you, I don't know if that has been difficult or not, but you
Hmm.
know, that difficult student maybe.
Yeah. Yeah. No, we've had, one of the hardest things to deal with in a program is not just a student failing, but a student failing so close to the end. Our program is a 4-year program. It's about to get changed. Our new cohort starts this fall, and it's going to be a 3-year plus 1 semester program. So we have chopped 2 semesters off now. But regardless, it's a lot of investment. And I think, we've had, I think maybe over the course of 12 years, there's been 3 students that failed out of the program in the 4th year in clinicals. That's a lot of investment. That's a lot of time. And it was painful because you can't help but go, we failed them. They should have never made it to that. And it's something that we've had to go back. It starts early. We go back to the beginning. And so I'm constantly working with some of our newer faculty, and they're like, well, I don't want to fail them because blah, blah, blah. And I'm like, no, stop. This is where we need to have those lessons learned. They can't learn these lessons after invest. We're not doing them any favors, right? And I never want to be in that position again. By the time they get in our program, they don't do their clinicals till the very end. They should be soaring through those clinicals and, really doing amazing, because if we do our job in those first 3 years, we either need to work with those students that need that little extra and get them there, or we need to figure out who's not appropriate for this career before they get there. So the most painful lessons for me was having those 4th-year fails and the heartache, because they become your family. These are, I call them all kids, even though they're all adults, but these are my kids. These are, you want to see them thrive. You want to see them come out of the nest, and to see that happen is heartbreaking.
Yeah. And I'm so glad you're doing that, just because, it wasn't your program, was another program. When I see that, again, my first thought is this is not like how other people allow you to get here, right? And my first thing was like, not blaming. I mean, it was just back to the school, like how a school did not see this coming. How another CI on this other past internship did not see this coming. It's very clear here that something is going on. So I'm so glad that things get changed. Again, that wasn't your program, because I have had only wonderful experience with
Good.
your programs, so that has been great. But either both programs, like the hybrid and the non-hybrid, so it has been really great foundation. But it has been other programs who I hope that they're looking back the way that you guys looking back, like from the beginning, you are going to be it, and that's not going to change. And if you can't, then you cannot, and then you may have to look into a different career. So, so glad that you're looking into that. So how can people find you?
Well, you can certainly see my bio on the Nova website, the Nova Tampa DPT website. They can also reach out to me. I'm happy to share my Gmail address. You want me to just share that here?
I can put that on the show notes, so they'll have that to connect.
Perfect. Yeah, they can find me by email. It's probably the easiest way, is to reach out by email. I realize I probably need to create I think I have a LinkedIn, but I don't think I've ever used it. I probably should do that. I'm learning to get into the land of technology, but but honestly, the best way is to email me, and I'm happy to talk to anyone. I do have a YouTube channel, so they can find me that way as well. I can share that with you as well afterwards. But in that YouTube channel does share my cancer journey.
Okay, excellent. How about one book that you would recommend for the audience?
So, yes. So, I'm not a big reader. I mean, other than what I have to do for work. And I think that's probably why I don't read for pleasure so much, because of that. But there was one book that my mom got me when I was diagnosed, and it's called The Silver Lining, and it says it's called a supportive and insightful guide to breast cancer. It's by Holly Jacobs. But it essentially goes through a person that was diagnosed with breast cancer, and it goes through their whole journey, how it affects their relationship. But what I liked about it is it was always about the silver lining and the blessings that came along the way, as opposed to focusing on all the negatives that happened to them. And so for me, those kind of things to read, when I was going through radiation, I picked up the radiation chapter and I started reading about them and what the silver, I sometimes need to be reminded, what is the silver lining? Because I'm struggling here,
That's, that's really
yeah.
good. Yeah.
So yes, that was a good book.
Excellent. Is any one question you wish I would have asked you and will you have answered it before for wrapping up?
I think maybe the only other thing that I didn't really share a lot was being a mother to two young children during cancer. That was probably the hardest part. Well, actually, it was, again, the silver lining to that was that on the days that I did want to stay in bed, I knew that those two were relying on me, and I knew that I needed to show them. So I kind of used this as an opportunity. I was very open with them. I sat down. I remember my 4-year-old, my 8-year-old son, my 4-year-old daughter, and sat them down, and they had just lost their grandfather to cancer. So they'd heard the word cancer. Luckily, they'd also heard the word cancer, because my father is a brain cancer survivor. So, and he's still with us today. And so they also knew that cancer didn't necessarily mean death, but it was fresh in their heads. And so I sat them down, told them that, I had cancer, and they were like, "You do?" And I said, "Yeah." And they said, "Well, where is the cancer?" And I sort of joked. I said, "Hi." I said, "It's in my boobie." And they were like, "Your boobie." And they were laughing. And then my son looked at me really seriously and he goes, "Wait, you have breast cancer?" And he was 8. And I was like, "Yeah." I was like, "Have you heard of it?" And he's big into football and baseball and basketball. And he goes, "Yeah." He goes, "Like, is that when the football players wear pink? That's for you?"
That's awesome. That's
And I said, "Yeah, buddy." And so then he thought I was like a rock star because all these people were in pink for me.
yeah.
But what I did is, I shared it with them and I let them ask questions. I was very open with them. And I told them, I'm going to be okay. I'm going to work, I'm going to, I'm really strong. That's why I exercise. That's why I eat healthy, is so that, I can set myself up to beat this. And, they did ask me a couple times, "Are you going to die?" And I said, "That's not my plan." It's hard, but it's hard to address because
Yeah.
I don't know. I don't know what fate has for me,
Yeah.
but I know that that's not my plan. And I know I'm going to do everything I can to do it. And so by being open with them, I think it was good. And by also staying active, they helped me stay active so that I wouldn't, so that I could be a part of their lives. And I wanted them to feel as normal as possible. And, and I found out years later how much it impacted my son. I found out that he would cry at school sometimes, but then he didn't cry at home because he didn't want me to know.
Oh.
And yeah. And it was little, yeah, I was like, "Oh my God." And but my daughter was so young, she would walk around with her baby dolls that had no hair, and she'd say, "My baby has cancer."
Oh.
And they were probably all like, "What?" So she had all these sick baby dolls at home because they all
Yeah.
had cancer.
Oh my God. It's amazing how kid can see on their minds that,
Oh
right?
yeah.
Like so innocent. Did you guys
Yeah.
ever went to like counseling or anything, like anything for the kids or your family?
So, I did. And my children had times where later on they ended up going to counseling, and I think it's come out a little bit about how it went. I think we're on the other side of it now, so it's good. At the time, I'm no longer married, but at the time I was married, and I know my husband really struggled because he had just lost his dad, and then his wife got diagnosed right as his
Wow.
dad was passing. So it was a really, really challenging time. But you know, at the end of the day, the kids really learned a valuable life lesson through this whole process. I think they appreciated everything that I went through, especially as they've gotten older and learned more about it and, you know, heard other not so successful stories about it. I think they are really appreciative of what I've gone through and how I stayed connected with them as much as I could. But it's a challenging situation as a mother to, especially to small children when you're going through that situation. Because you want them to stay positive and you want to, you know, stay strong, but you also want them to know that it's okay to have a bad day and it's okay to cry every now and then.
Absolutely. Oh my God, I can talk to you for hours and hours.
I know.
I mean, we do this all the time, right? You come from a site visit and we were like,
Mhm.
we talk 5 minutes about the student and
I
then
know.
we start to talk about everything else. Like,
I know the poor students over there like, hey, do you care about me?
yeah, it's like, what is it that I'm here for? So it's always love to talk to you and we can continue doing this, but I know you have things you gotta do, taking care of that doggy over there, like,
Yes,
Mom,
I know. I'm so
it's
sorry.
time for dinner. No, it's totally fine, totally fine. So thank you again for doing this with me. I really appreciate it, Robin, and thank you for sharing your story. I learned already so much from you that
Thanks
I
for having
didn't know
me.
before, so that's awesome. Yeah, I really appreciate it.
Yeah, thanks for having me. I really enjoyed doing this.
Absolutely. Have a great evening.
Thank you. You too.